My name is Doreen Rock, and I'm born and raised in Ottawa. When my husband was 50, he was diagnosed with Parkinson's disease, which is considered to be early onset. So it was a journey with him, struggling and dealing with this pretty nasty illness. And I took care of him for 12 years at home. His care became too much, and he had a fall, which often happens, and ended up in the hospital for a couple of months, and eventually moved to long-term care. My husband passed away almost 3 years ago. He is my passion, and this is why I've gotten so involved with family councils and long-term care homes. I sit as a member on one of the LHIN committees, so have an opportunity to meet monthly with members of the healthcare system and the LHIN and provide input from a family perspective. And I bring my experience from taking care of my mother and my aunt, my husband, myself, and now I have a brother whose health is declining. So
I believe there are benefits for both the health system and for the patient or family or caregiver to be engaged in the health system planning and decision making. So by engaging people who use our healthcare system, we're really grounding our decisions based on the needs and experiences of people. That is the emphasis and the crux of a person-centered healthcare system.
Getting the input of the front-line user brings brings the healthcare system to life. You may think things are going very well, but if you are actually at the front end of receiving the services, sometimes it doesn't always get delivered in the manner that management hoped it would. Everybody's needs are different. Everybody's expectations are different. And I think it's a very complex health system that we have, and you almost need a navigator to help you get through all the services that are available. I mean, we're very fortunate that we have a lot of supports, but sometimes as a patient or a caregiver, you're overwhelmed with all the different jurisdictions that provide care. I don't believe anyone goes to work thinking they want to do a bad job. They all want to give their best and take care of the patients and the residents and the families along the way. If consultations with the family, friends, residents, patients in the healthcare system was not available to the healthcare providers, I think the healthcare system would be less responsive to the needs of its citizens.
The Champlain LHIN engages with patients, caregivers, and members of the community to hear and respond to their needs and concerns. This is important so that our plans and decisions are based on their experiences and realities. So by engaging with members of the community, our decisions are informed by patients and caregivers, and they play an active role in health system change. We know this leads to more sustainable, effective, efficient solutions, better healthcare outcomes, and a better healthcare system overall.